If you said C, MRCP, this is correct as this patient most likely has PSC. Now we'll shift to talking about some of the inherited liver diseases. Wilson's disease is an autosomal recessive disorder of copper metabolism leading to decreased biliary copper excretion, which in turn causes it to form deposits in other tissues like the liver, iris, kidney, and brain. It classically presents with abnormal behavior, personality change, psychosis, choreiform movements, tremor, dyskinesia, and arthropathy, and jaundice. The characteristic finding in Wilson's disease is the Kaiser-Fleischer ring of copper deposits around the outer edge of the iris. On labs, serum ceruloplasmin will be low and urine copper excretion will be elevated, but liver biopsy is the gold standard for diagnosis and will show increased hepatic copper deposits. Treatment includes penicillamine or trientine to help chelate and excrete copper, and if caught early, the prognosis can be good as long as patients are treated, but ultimately only liver transplantation is curative. Hereditary hemochromatosis is an autosomal recessive disease and is caused by mutations that lead to increased iron absorption from the gut and deposition in the tissues. It can cause cirrhosis from increased iron deposition in the liver, as well as skin hyperpigmentation, diabetes, hypogonadism, cardiomyopathy, and arthritis. Patients will have increased ferritin levels and a transferrin saturation greater than 45% in women and 50% in men, but biopsy is the gold standard for diagnosis. First-line treatment is actually periodic phlebotomy to decrease iron stores, but chelation with desferoxamine is indicated for patients who do not tolerate phlebotomy. This can help slow down progression significantly, but transplantation is curative. Alpha-1 antitrypsin deficiency is autosomal dominant and is caused by a mutation in a pyridase inhibitor enzyme that leads to decreased release of alpha-1 antitrypsin from the liver. The classical manifestations are early onset emphysema and cirrhosis. Screening is performed with serum A1AT levels, which should be low, but can be confirmed with either genotyping to look for the specific mutation or liver biopsy. The only cure for cirrhosis caused by alpha-1 antitrypsin deficiency is liver transplant. Alpha-1 antitrypsin supplementation can help delay the progression of emphysema, but it will not prevent the progression of liver disease. Let's go on to another question.